Okay, it's not a webinar without a technology glitch. Just a little bit of housekeeping information here. As you can see, we are recording this session, so you can go back and listen. Just good news, they're all posted on the MHTTC website. You can use closed captioning. You are muted at entry, but we will have a Q&A session later. You definitely have the chat to communicate with either folks doing, the tech or with questions or concerns. We will send out certificates of attendance. You'll get that in a follow-up email along with copies of the slides, as long as all our panelists are okay with that. And we'll let you know when we get to that Q&A portion. There's also an email there, newengland@mhttcnetwork.org. I'm always terrible at advancing this one. All right. So just the regular disclaimer that the views and opinions expressed here are views of the speakers and do not necessarily reflect the official position of the Department of Health and Human Services, or SAMHSA. We do encourage and strive to use strengths-based, person-centered, inclusive language. Having said that, we know that that is something that is ever evolving and changing, and also people have different opinions on things. So we just ask that we use it in a respectful way and have respectful dialogue when we have differences. And then rather than reading a traditional land acknowledgement, which I know a lot of us do, we just want to say that as a committed ally, New England MHTTC recognizes that the New England area is home to the ancestral land of many Native tribes, and that consistent with our values of community inclusion, we acknowledge that all the places our distributed staff live and work, as well as where we provide services and hold events, are Indigenous lands, and we are indeed coming to you from and working and living on places that are stolen lands, and acknowledge that it's important to consult Indigenous peoples in recognizing that this is not just something from history, it's something from today. They are alive and well, and we should look to them for guidance as we take action to support them today. So the action piece is always important. Okay, so wanted to say before we start that this is a topic near and dear to my heart. I had the life-interrupting experience of being separated from my mother starting at about age 2, and for most of my childhood and adult life, due to her being hospitalized and institutionalized for decades. So that trauma has impacted my entire life. Besides this direct impact, I also have worn and continue to wear many different family member hats, as well as being personally impacted. And having done this work in mental health and with a lot of families and individuals over the years, I think it's clear that even if people have various experiences with their own families, the reality is our families are often natural, lifelong supports. Parents are unfortunately sometimes often blamed or are expected to fill unpaid roles for their children, in addition to all of the regular roles we all fill on a daily basis. And then other family members are often marginalized, discounted, or invisible, or even, pretty much left out of the picture entirely. So even if an adult individual who's receiving services or needs supports does not want to include their family or significant others for whatever period of time in treatment or recovery, the family still deserve and often need to have their own support. So that can be separate, although when it's together, it's a very powerful thing to have that kind of natural support. And family members can also fill family peer support roles, and that's something we've heard a lot about from individuals' lived experience. Peer support is huge, growing, evolving, and we'd like to see family peer support continue to grow and evolve. So I think we'll hear a lot about that today as well. Again, topic near and dear to my heart. And so I have the pleasure of introducing our first speaker, which is Gail Cormier, who is Program Director for the National Family Support Technology Assistance Center, NFSTAC, from the National Federation of Families. So Gail, we're happy to have you here with us today to lead off and let us know what we're doing nationally.
Thank you. Thank you. And I too am a family member. That's how I got my job here. And in the past, as the state executive director of the state family run organization in North Carolina, and I know I have a New England accent. I am a parent of 3 daughters, all who are adults now. My youngest is 26 and my oldest is 40. So I have a little variety there. All of them have had behavioral health issues and still have any issues. And that's actually why the National Federation of Families and NASTAC moved from just working with families and supporting families from 0 to 26 to supporting the families through a lifespan. Like Cherie, I have a dad who was diagnosed with schizophrenia long before I was born. He was diagnosed while he was in the military. So I have a long family history. I have a mother with mental health issues, aunts, uncles. I mean, I have a full array of mental health issues in my family. And I have experience with anxiety. So that's who I am in the mental health world. But today, I am going to talk about the National Federation of Families and NASTAC, the National Family Support Technical Assistance Center. Next page. So, what I want you to learn from this presentation for me today is who we are, what we do with data and research and reporting, which we think is really important for all of us to do, our national campaigns, our national certification process. And the national certification process is for family peer specialists. So that's the peer support piece. We have legislation and advocacy. And of course, we have our annual national conference. I hope you are coming. It's going to be in November in Orlando. And by the time we get there, we're going to be so cold that we're going to love to be in Orlando. And we're going to be just down the street from Universal Studios and Disney. So we hope you join us and come to the conference, but then play a little later. And of course, we have the Technical Assistance Center, which is what I'm going to talk most about today. Next page. So who is the National Federation of Families? Well, I just described my lived experience, but I can say all our staff have lived experience and lived family experience. Our board, we have a family-run, we are a family-run organization, so that means our board is over 51% of individuals with lived experience. The Federation always promotes family peer support, and I'm so glad we're talking about it today. And actually, we just came out with a new free curriculum that's virtual and self-paced. We believe families are the experts, and you know it, and I know it, that even in a physical health issue, I could look at my daughter and say, and she was perfectly healthy, walking in the door from school, I say, "Hi, what's up?" And she says, "Not much." And I can tell she's coming down with something. As a mother, you can see it in their eyes or just the way they move. And that is true for all aspects of being a parent and understanding our loved ones. And of course, we always accept, advocate, and act. We are and always will be a champion of social justice, and we always, always, always advocate for families and support all family-run organizations throughout the country. And we have about 146 affiliates that belong to the Federation of Families. But if you're a family-run and you're not an affiliate, I'd encourage you to join. but we still support you and you can always ask for technical assistance. Next page. So what do we do for data research and reporting? A lot of our data and collection is through surveys at the end of different presentations, Survey Monkeys. And I know a lot of us are really tired of that, but they are important and we do use them. But we also do a lot of coming to you and doing listening sessions. We either do them in person, which we have, and I think we're going to be dedicated to do more in person regionally as the years go on. But currently, we do many, many listening sessions virtually. We go to our communities. We host listening sessions during our conference. And we really want to hear what you feel is the need for us to do more. So when I say, please tell us what we can do for you, I really mean it. Our family peer workforce. I had mentioned that we have just started a curriculum and it's online and it's free and it's virtual. We support the family peer workforce. I have been promoting family peer workforce since I was in New Hampshire as part of the Alliance for Community Supports and worked with Granite State Federation of Families and NAMI during that time. But so I learned what a family partner was from NAMI and Granite State Federation of Families. So my basic experience has been from New England. And we bring that nationally and we support across the country, obviously, the family peer workforce. We have different trainings. And of course, we have our national certification that will help you, we test on the competencies and it'll help you secure a better position or have that seal of approval for you to look for different work and to expand your experience. Always surveys, and we have that network of affiliates. As I said, there are about 146. Next page. Our social justice campaign, a couple of years ago, we realized that although we've always been a champion for social justice, we realized we were not explaining that deep enough. So we made a dedication about 2 years ago that everything we do and every event we have will have a social justice objective. Our conference will always be social justice focused. You just saw, if you were able to attend last week's Summer Institute, it was a social justice interest institute. And, we believe in everything we say, and we believe for equity for all. And if you look at our taglines, when I send you an email or anyone from the National Federation of Families, we have our own value statement according to how we believe social justice is. Next page. So what did we do recently? If you notice, we have begun saying mental health acceptance month, mental health acceptance week for the week of children's mental health. We believe that awareness is great. And we're hoping that everyone has become aware, but the real transition, that real action is when you begin to accept, yeah, I'm aware that there are some people out there that might have mental health issues, but I accept that people, even myself or my own family, have mental health issues. And what can we do? Accepting is more of an action statement. Next page. And of course, we have a legislation team, and it's led by one of our staff people named Michelle Cunningham. And she sits on all the legislation and advocacy panels for family and mental health. We strongly believe in parity. And of course, the peer workforce helps not only social justice issues, but it helps bridge that gap to help individuals and families find parity. Next page. And I already spoke about this. It's our annual conference. I am really excited to go to Orlando this year. Last year we were in Chicago, and I have been going to these conferences since 1996. And I always say this is the best one yet. I swear Chicago was the best one I've ever been to. It was a lot of fun. We saw a lot of movement. Not only did we see a lot of families and family-run organizations there, there was something a little different. We saw social workers and nurses and therapists and psychiatrists there, all there, which was great, but there because they were wanted to learn about families and how to partner with families better. And you can see the movement in our country, you can see it in our states, and it's really exciting. So I hope you join us in November. So the big question is, what's the NASTAC, the National Family Support Technical Assistance Center? Well, I can tell you it's SAMHSA's first family support center of excellence. And we began 4 years ago. This September will be our 5th year. And after our 5th year, we're going to have to renew again. Hopefully, we'll get refunded. You never know. But we're hopeful and positive. This Family Support Technical Assistance Center really focuses on families with mental health or substance use. Next page. It's rather interesting that NASTAC not only works with mental health and substance use, but we expanded it to be the lifespan, and we expanded it to actually cover military pieces. So as family members ourselves, we know that our children remain our children for our whole lives. And that means that we have to go beyond age 18. You know, I remember when I first started here, I thought family support was really between 0 and 18, and transition age was 14, maybe to 26. And the more and more I'm in this field, and I bet everybody here can agree with me, it gets more expansive. And just because a child turns 18 or a child turns 21 or 26, their mental health and behavioral health issues do not stop just magically because they turn that age of majority. And we don't magically not become their parents. So as parents and as family members and loved ones, we support our children and our loved ones through the lifespan. That includes sibling to siblings. Next page. So what are our goals at the Technical Assistance Center? Well, we do a lot of information of the workforce. From September to June every year, we have monthly office hours hosted. We just finished up our last office hour yesterday. This year it was focused on the family peer workforce. In past years, it was focused on executive directors and associate directors and family leaders. Our goal is really to inform that workforce. We also have webinars once a month, and we have family. We focus right on the families and the family communities. So we have 2 different family events each month. One is called the Family Living Room, and that is a very, very small group, no more than 25 or 30. It's held by Sue Bardo, a wonderful national family leader, and we just talk really about those family issues, family to family. And at the end of every event, we decide what the topic will be for next month. The other family event is called Family Connections, and that's more of an informational. And we do that once a month too, from September to June. And that has a community, I think we have 300 or 400 people attend those. None of our family to family events are recorded, but all the other events are. And because we want to say, we do the Vegas rule, we want you to feel comfortable. What you say here, we want you to contribute and talk, stays here. We also increase, I'm not done. Sorry, I talk a lot on this page. We have a great area for resources. We have a great toolkit for families. A toolkit for the workforce will be out in the next week. We have a free curriculum. I really encourage you to go to our resource page and and if you don't see anything that we created during the lifetime of this grant, We also have a resource library with things from MHTTC. So we have lots and lots of resources in an electronic library. We do private technical assistance. So you can always go on our webpage too and fill out a form, and someone would get back to you within 24 hours and we'd give you technical assistance. Okay, next page. And of course, everything is to support the families and caregivers. And it's not limited to these 5 areas. We ask us a question, if you don't even see it or you don't, if we can't answer it, we'll connect you to the person who can. Next page. So what are the kinds of organizations that really use our services? The organization, individuals, it can be anyone, but we do a lot of support for many of those. Go back one more slide. So you can read this and see that we do a lot with the family peers, but we also do, we do the community members and recovery organizations. And a family peer specialist. No, we'll go to family peer specialist. Can we move one more page? There we go. Nope. Why are we, that's kind of unusual. It's kind of going fast. It doesn't want to talk about family peer specialists. You will get these slides. You have my permission to use any of them. Oh, there it is. If it doesn't stay on here, you'll get the slides. We can talk about family peer specialists without looking at the slide. But who is a family peer specialist? Well, it's a parent, family member, or caregiver who has lived experience helping their loved one, their family member, navigating the systems. We have a little ghost in our slides, don't we? So if you're a primary caregiver, you don't have to be a biological family member. You could be a family member of choice. And that is the person who has navigated a loved one through the mental health or substance use world. They can speak about and use their own lived experience to support other families to advocate for their child's or family members' well-being, supporting them in navigating systems, and providing other necessary resources. We understand that there is such a special gift that a family peer specialist can do while working with the family, and that is strategically sharing those pieces of lived experience at the right time to help the families not only bond and trust the family peer specialist, but also connect and realize they're not the only one out there in the world. And of course, who can help navigate those confusing systems, whether it's the young child or the adult world, than someone who has walked that walk. Next slide. I think there's a ghost here, Sherry. There we go. One of the other things we do is the National Federation of Families, not NASCAC. We try to keep a wall because what we do is a lot of training, and NASCAC may train on the competencies and all the things necessary to be a good family peer specialist in the workforce. But the other side of our wall is the national certification. And I will be honest, I've never seen the test, so I can't even teach to the test. But the certification is out of the Federation of Families, and it's quite the process because we want to make sure our family peers who take this test understand the competencies and are really aware of how to be a family peer specialist in the best way possible. So what's the benefits? It's a uniform core knowledge. So when people see, oh, you have the National Family Peer Specialist certification, everybody will know what that is. And I know family peer specialists come with very, very different names across the country. But this certification says family peer specialist, and it covers family partners, parent partners, whatever your own state and your actually organization calls those family members with lived experience who are helping other family members. The requirements, it's 88 hours of training in the 5 core competencies. And I did say we have an online training that covers them. And if you took that online training, you would get 8 hours to contribute to those 88. It's 500 plus hours of family peer support, paid or volunteered. So this doesn't mean that you have to do 500 hours as a paid worker before certified. You might be doing family peer specialist for your niece who has a child, and it's informal. As long as you can kind of document that, that would be great. You do need 20 of those 500 hours to be supervised. Lived experience, you have to think in your head when you fill out the application of how you can write a narrative about your lived experience online. And of course, you have to pass a national exam. 120 questions in 120 minutes. And you might say, oh my goodness, that's a lot. But actually, a minute is very, very long. And most people finish those 120 questions in less than an hour. Next page. So our curriculum, if you go to healthyknowledge.org, also, if you go to our resource page on the NASDAQ.org website, you will see it right up front and you can click right into it. But it covers all the competencies. And here's something very special. If you like my voice, I happen to not like my voice, but if you like my voice, I'm in that a lot. So you can hear me talking about being a family peer all through the curriculum. And it goes through those resiliency and recovery and wellness, affecting change, creating a person-centered plan with the family, systems knowledge, and of course, a very important one, professional responsibility. So I encourage you to look at that curriculum, take it. It's not that hard, and you will brush up on your skills that you might already have, or if you're looking to be a family peer specialist, you will certainly learn what it is all about. Next page. If you have any questions, you can always contact me. There's my contact information, or you can talk to the Executive Director of the National Federation of Families, Dr. Linda Goggin. We're always here and we always answer your questions. So I want to thank everybody here today for listening to me, and I'm going to pass it on to the next person.
Hi, and the next speaker will be Jenny Bridges, Executive Director from Favor in Connecticut.
Thanks, Cherie. Thanks, Gail. So good afternoon, everyone. Like Cherie said, my name is Jenny Bridges. I'm the Executive Director here at Favor in Connecticut. I am also a parent. I'm a parent of 5 children, so I have the lived expertise as well. Some of my children's challenges is what got me into this work. I came to Favor 16 years ago as a family peer support specialist, and I am now the ED. So I'm thankful and grateful for the opportunities that I've been able to receive all of these years with, the network of support. So Favor is a statewide multicultural family-run organization. We are 98% of our staff have the lived experience as a parent or caregiver. We have several programs. Our family peer support program provides the direct support and advocacy for families across the state. We have a specialty in special education. So families are usually referred to us because they need help kind of navigating that special education, behavioral mental health system for their child or youth. Last year, we received about 1,100 referrals for peer support. And this year, we're definitely going to surpass that by 100 or more, just showing the importance of peer support and how families really, really see it as a valuable service to them, right? For that program, we have 2 types of referrals. We have what's called our brief intervention referrals, which are from anywhere across the state. Families can also self-refer. Those can be anywhere between 3 months to 6 months. And then we have our other type of referral, which is through our system of care. And those we have contracted relationships with our community care coordinator providers across the state. And our peers work in a team to help our families build their child and family teams. And those are really integral part to meeting the individualized needs of families, you know, building their formal supports, their informal supports, natural supports, so that there's that wraparound and the family can continue to meet their needs and become self-advocates. We also have our Family System Manager program, and our staff in that program work in partnership with a variety of community providers and state departments. They provide technical assistance to many groups across the state, such as our regional advisory councils, our citizen review panels, and support groups, where they often co-chair these groups across the state, always bringing the family voice and perspective to the table to ensure that there's that equitable practice, right? They navigate issues more on a macro level, and they have a partnership with, we have a partnership with the Department of Children and Families, where our FSMs meet monthly with our system program directors in each region and discuss family engagement and come up with solutions for the needs of the region, right? So what are families experiencing in child welfare? Our FSMs really bring that family voice and perspective to ensure that the needs are met. They also provide direct support, mainly on system level issues that require a systematic approach to affect policy and practice. And they provide support and guidance to our parents, caregivers, youth, young adults as well. And we prepare them for system level advocacy. Another program that we have is our Learning and Leadership Academy. We provide trainings year round, facilitated by our lead training coordinator, as well as our family peer support staff and our FSM staff in their areas of specialty. Trainings are offered virtually and in person upon request from anyone in the state. And to date, we have engaged, for the fiscal year of 24, we've engaged with about 540 participants, parents, caregivers, youth, young adults, and providers. Our staff is also involved in a continued partnership with the Department of Children and Families Workforce Academy through our LLA, and our staff provide training to new social workers on family engagement through a simulation lab, better known as role plays. And basically our staff act as, you know, families, because they are families, and we navigate a variety of different scenarios, intimate partner violence, discipline, you know, substance abuse. And we're really there to support the new social workers in navigating family engagement so that they're appropriate when they're going to home visits and they're able to have the maximum success with families, you know, with those wraparound principles, equity, and inclusion as well. As Gail stated, we're thrilled that as Favor, we are a Connecticut state affiliate for the National Federation, and we will be starting to provide the infrastructure for parent caregiver interns to receive the training and support necessary for that national peer certification. So in true peer support spirit, we have literally documented all of the trainings that they can be a part of in the state of Connecticut and nationally, so that our parent peer interns can kind of go through the process with us. Some of us are up for recertification coming this November, so they're really going to be walking that walk with us, and they're going to have us there at the table to ask questions. And so it maximizes their ability to really pass that exam. We're really, really, really excited about that for our parents here in Connecticut, and we hope to grow that, you know, in the years to come. We're thrilled about the curriculum. We added it as soon as it came out. So we're really, really thankful for that. And lastly, I want to talk about our medical home program, which helps provide families with respite and extended services funding. So families who are eligible for respite, this particular program is funded by our Department of Public Health. And families who are eligible do receive a check for respite to be used in any way that they see fit, right? We can't tell families what respite means to them. They can use it for adventure park tickets. They can use it for summer camp scholarships, or they can use it for childcare. Maybe dad and mom need a night out. That's something that's really valuable to families here in the state. And that is from birth to 14 years of age. There were some restrictions that we had to work with the Department of Public Health last year, but it's still a valuable resource so that everyone knows. The extended services part of that program really provides help with prescription cost coverage for children that are not insured or underinsured. So migrant families really benefit from getting prescription cost coverage. The children on our program currently, the top 2 diagnoses that our children in that program have are either diabetes or liver transplants. There's also children that have failure to thrive, so they need specialized formula. We are able to pick up those costs for them till the age of 21 or until they are able to get on Medicaid throughout the state. So that is all for me. Thank you, everyone. And it is my pleasure to introduce Pam Sager, the Executive Director of the Parent Professional Academy in Massachusetts.
Thanks, Jenny. I appreciate it. How exciting. Actually, I love hearing everything that Connecticut has going on. And Jenny, I'm definitely going to follow up with you. I'd love to meet up with you sometime because there's so many things. You know, one of the things that's kind of interesting about this is the fact that each state does things their own way, right? So we're also learning from each other about some opportunities. So I'm Pam Sager. I'm the Executive Director of the Parent Professional Advocacy League in Massachusetts. And like Favor, and I'm sure like some of the other organizations, we are a family-run organization, an affiliate of NFF, and have been for many years. In fact, I think my predecessor was part of the kind of the founding group for NFF, or an original member. At PAL, we focus on 3 main things, and that is providing family support, family education, and advocacy for families within the state. We are fortunate to be supported by state contracts, federal SAMHSA grant, and some private foundation money, which means that all of our services are free to families. We do not take insurance at all for the work we do, and there's no wait list for any of our services, which, as most of you know, is a huge thing right now because so many people are struggling with wait lists. We also are very fortunate to serve in one way or another between 4,000 and 5,000 families a year. We've got a very active group that is often very exhausted, but it's a lot of fun. In particular, we do just mental health. We do not do substance use. We have other organizations in the state that are fabulous at that, and we work with them, partner with them, and make referrals to them. We do have, unlike probably some of our other affiliates, we do have a substantial piece of juvenile justice. So one of our contracts is with our Department of Youth Services, and we do substantial work at the intersection of juvenile justice and mental health. So that is something that sometimes sets us apart because of our substantial work in the juvenile justice realm. So how do we provide support? We provide support like many of the other organizations. We do one-on-one family peer support. 100% of my staff, I'm happy to say right now, has lived experience. We are a staff of about 25, and we all have lived experience. And as you can imagine, with 25 people, the experience is broad and deep, which is kind of cool. I say when we interview people, we're the only ones really that get excited when you tell us about all the problems in your family. We're like, yeah, you know, you're perfect. So it's a little bit of a different way to think about things. We also provide families with support groups, and we actually run about 8 to 9 support groups a week. So we have a lot of support groups, some of them specialty groups, like parents that are raising LGBTQIA plus kids. We have a Spanish language support group. We have a grandparent support group who are raising grandchildren. And transition age youth support group for parents as well. We also have a pretty significant focus on multicultural outreach. We have specific team dedicated to multicultural outreach, and so that we can hopefully meet the needs in the way that many people would like to see their needs met. So we do have language capacity internally with Spanish and Portuguese as well, and we are always trying to increase that as much as possible. We also have staff dedicated to crisis and to acute needs, including emergency department boarding. Right, and then we also are the national or the Massachusetts chapter of National Youth Move. So we have a Youth Move group as well for transition age youth. How do we educate? Well, we also provide, like Favor, we also do trainings for families and also professionals and others in the children's mental health space. Those monthly trainings, we run approximately 8 trainings per month, which at this point are all virtual. We have statewide topical meetings. We have bi-monthly policy and advocacy meetings. We have regular parenting sessions, active parenting, and we're going to be adding PACS tools, which I know many of the I know NFF is familiar with, and many of the affiliates are. We're going to be adding PACS tools. We do a bi-monthly newsletter, Facebook videos, 5-minute Facebook videos on various mental health topics. We have 4 active Facebook groups at PAL. We do have an annual conference, which I'm happy to say was just about 2 weeks ago, and it was successful, and it's done. As all of you guys know, a lot of work. We also collect data from families on a regular basis and share that data out. We have, if you go to our website, you'll see pop up, we have a question of the month. Every month it changes, and we collect that data and share that data out. We also do first responder trainings throughout the state on how to deal with families and children with mental health issues, and they have been very well received. Our advocacy is strong. We are fortunate, very fortunate, to be willingly included in many state advocacy efforts here in Massachusetts. We meet with the Department of Mental Health and Mass Health, which is our Medicaid group, on a monthly basis to share family concerns, to share strategic planning things, policy things. So we're very fortunate to have that great relationship. We have a great relationship with the Department of Youth Services, and also meet with the Department of Children and Families regularly here as well. We teach family advocacy skills. We do, as I say, have a bi-monthly policy and advocacy meeting where our goal is to really be able to share kind of what's currently going on out there, where we need, kind of people to push, support, so on and so forth. We're a founding member of the Children's Mental Health Campaign, which in Massachusetts is a strong children's mental health advocacy organization. We have people in the campaign that are just devoted to nothing but legislative policy and advocacy work at the state level, and PAL is a founding member of that group. And we're affiliated with NFF as well as National Organization Justice for Families. And we have staff on so many different commissions, committees, involved in organizations, stakeholder groups, so on and so forth. It's actually fabulous. We're a very busy group, and when I go through this list, I'm always a little exhausted, to be perfectly honest with you, because it's a lot. I forgot to kind of tell you, I'm a mom too. I think most of us in these organizations are. I have a 22, 23-year-old and an almost 27-year-old. And it was my 27-year-old who brought me to this work. And actually we adopted her at birth. So I also am an adoptive mom and a bio mom. So I kind of fall into that category as well. And my 27-year-old has been a client of the Department of Mental Health since she was about 13 or 14, and continues to be, but is doing great and hasn't been hospitalized in several years. So yay! So that's, we welcome anyone anytime to give us a call. If you have questions, or if you need a referral or anything, we're here in Massachusetts for you. And thanks for coming, and it's nice to be with you guys. Oh, yes, and I have to do my little job here. I am happy to introduce Cindy Seekins. Cindy is the director of GEAR Parent Network, which is a program of crisis and counseling services in our beautiful state to the north of Maine.
Oh, thank you, Pam, and your organization does wonderful things. So, as Pam, I am a family member also. I began attending GEAR support groups before GEAR was an actual organization. We were grassroots. And do you want to put up my PowerPoint? Because I can get through this in 10 minutes quicker with some direction here. I have a blended family of 4 boys, 2 biological, 2 stepsons, and lots of grandchildren. I think I'm up to 12 now. And some of those grandkids also have behavioral health concerns. And so in 1988, I started attending these support groups for my youngest son, who was 8 years old at the time, and kind of grew up with the National Federation and GEAR. GEAR became officially established in 1992, meaning funded. And we were asked by the state of Maine, because we are funded through a mental health block grant, which I'll talk about in a minute. And Crisis and Counseling was asked to be our fiduciary. And I'm happy to say today we have a wonderful relationship with them. It's really good to be part of a mental health agency. It's actually a benefit to the families we support and to our staff to have that additional mental health support when necessary. So we are family driven and totally parent run statewide organization, and we support families in Maine who have children with emotional and behavioral health needs. And so this is our 19th year as being the statewide sponsor of Children's Mental Health Acceptance Week campaign, and we follow the same campaign as the National Federation of Families. Next slide. So our primary funding sources are a Children's Mental Health Block Grant. Unfortunately, we've been flat funded for 15 plus years. And so we've gone from 13 staff, and we're currently down to 6 staff with the same funding. We have a system of care grant that ends in August of this year. And that was to provide family peer specialist support to families on the HCT or Section 65 wait lists. And so we got referrals for that. Our secondary funding is that we created a family peer specialist certification. It was out of need because our state created behavioral health home organizations, and they are mental health agencies providing behavioral health home services. And part of that is a requirement to provide family peer specialists. However, those organizations at the beginning didn't really want to pay us to provide family peer support. So in lieu of that, I just thought, well, if they don't want to do that, then in order to maintain the role of family peer specialists across Maine, we decided to create the curriculum in 2014, and we trained the family peers that they hire. So we also created an application process with certain criteria to ensure fidelity to the role. So then some of those organizations couldn't keep or find parents to hire for that role, so they contract with us. So now we have that benefit from doing that also. So we have just a few contracts with some mental health agencies for that support. Next slide. So part of what our block grant identifies that we need to do is two things: provide community family peer supports and in-home. So for this piece, this is short-term family peer support on the phone and in the community, providing emotional support, information referral, much of what you all do, advocacy in the systems of care, navigating all the child serving systems. We also provide 16 virtual supportive educational workshops quarterly. We have 16 counties, so we are do one associated with each county, even though it's virtual. And that's one of the only benefits of COVID is we went totally virtual, and we can now reach more parents and eliminating the barriers of transportation and childcare in order to attend an educational workshop. We call them supportive educational workshops because we allow parents to interact in those workshops and ask their own personal questions regarding the topic we have. And we do not record for that very reason, to maintain that parent's confidentiality. And so we do topics on whatever it is around parenting, skill building, self-care, mental health education, and the parents decide, we ask what they want each quarter to learn about. And so they help drive what we educate on each quarter. We also have family community activities and events because as family members, with kids with special needs, we tend to isolate ourselves. And so we want families with like kids to come together and get and feel like a part of their community again. And then we also do weekly virtual support groups, and they were very needed during the years of COVID, and they continue to be now in Maine, very much needed. Okay, next slide, please. So the other part is we do long-term in-home support. And so in the fall, it started in the fall of 2009, seeing the need. At that time, I was the family peer supervisor, and I was seeing the need for these family members to have us come to their home. And in kind of piloting that informally, I told our director at the time, this is where we can make a difference, because I see so much and learn so much from being in their home, and they feel more comfortable sharing personal information. I can help them better help them. And so we implemented our in-home support program. And then in 2010, we required all our family peer staff within 2 years of employment to obtain their national certified family peer specialist credentials. So that really helped to inform everyone that our staff had uniform core knowledge and skills. And I see this as a huge benefit versus just standard lived experience. We offer, because we have this funding, we offer at no cost this long-term in-home support. And we work with the families, not for the families. And the family creates the conditions in which this may occur. So during that time, we support them on things that they identify that they want to learn about or know about or do. but we also have strategic education that all our family peer staff provide to every family that we support. Education around their use, mental health diagnosis. What is family-driven care? Understanding what that is and that they're in the driver's seat always. They know their child best. A study, outcomes, education. And so one of the things we want to do is start preventing those adverse childhood experiences. And you start that with the education, with the ACE study outcomes and what that means. And then we teach them about what is trauma-informed care, because many of our families have been traumatized by our system. They've been traumatized by their own family. And so they need to know the importance of what trauma-informed care is. And then the importance of self-care, taking care of yourself. So you're an example to your children, and that builds that in the next generation of that importance. We also ask our staff to give the family a simple one-page form, and it's called a family vision plan. And with the parents, they help them reconnect with thinking about what were their goals before they had children and before life became crisis on a daily basis or a weekly basis. Sometimes we're in the throes of that crisis so many years, we forget about what our goals were. And so that kind of brings it back to thinking about that and start working on their future again, both for themselves and their family. So our programs are combined RAMP, and I'll explain what that means in a minute. Restorative Approaches Main Project. Our average length of stay data is 4.2 months for RAMP families, and then System of Care families is 6.9 months over the past 17 months. And what that tells me is the families that are referring themselves under RAMP, they are not as stressed and needy as the ones that are being referred to us from our System of Care partners. And those families are on the home and community treatment wait lists. And so we have wait lists, and their family is stressed because their children are not getting their needs met. And so it takes us longer to navigate the system and to get the support they need and get them in a place where they can even accept that. Next slide. So for our RAMP, which is Restorative Approaches Main Project, our in-home support, we utilize two tools to measure parent progress. So for us, it's really important to know we're making a difference besides just having a survey. So we utilize targeted parent assistance, and this was originally created by Keys for Networking out of Kansas. They had a 10-level continuum. We whittled it down to meet our needs for 4 levels. And so these are the 4 levels. And then we use family journey assessment, and that was developed by Montgomery County, Maryland Parent Organization and Georgetown University. We've been using it for quite a long time, and we were also part of their research project to provide data to aid in parent support becoming an evidence-based practice. Last 2 years was the last time we submitted data for that, as no one is responding to our data information any longer. And so that's 37 questions of the FJA that we use. And it really helps us to see the areas where families are initially strong and where the needs are that our staff could focus with that family. And then we also distribute a quarterly satisfaction survey to know how their services are feeling to them. Are they feeling like they're being empowered? And again, for our contracts, we report out quarterly on data. Next slide, please. So, and please remember, that we are the only family-run organization in Maine that provides this intensive long-term family peer special support and employs only families, parents and caregivers with lived experience that also require state and national credentialing of their family peer staff. So I'm kind of proud of that because I really feel like that level of education and knowledge besides their lived experience, having that certification gives us these outcomes. And our contract says we have to serve a minimum of 100 families for 1,000 direct support hours a year. Well, that averages to 10 hours per family, which is not very much. And you have to do a lot in that time. So during the past year, we served 118 families on an average of combined of the block grant and system of care for 5.5 months, had a total of 1,082.75 direct support hours, and our success rate getting those families to a TPA, targeted parent level 3, because when they get to 4, that means they are at our level and they could advocate and participate at the state level. And so we want to get them to a level 3 to be able to support their family and navigate the systems independently. And 94.25% success rate. So that's why I really wanted to provide some of this data to you to help you understand the importance of national certification. Some of the data we have for our community support is we did 96 educational workshops, 58 support groups, 7 social events, and we had 5,112 contacts with families, meaning phone, text, email, one-to-one in the community with 100% parent satisfaction. Next slide. So for Maine on the horizon, we have potential partnerships. So what's coming right now is Ruby, which is called Research Units and Behavioral Intervention. The state has a pilot implementation of 24 sites, and they're going to have 10 families in each site with children who have a diagnosis of autism, ID, or IDD. So this is going to occur on over the next 9 months. So family run organizations, staff, and providers will participate in this. We've already had this Seattle Children's Level 1 training, and we're getting ready to contract for at least 1 pilot site to administer Ruby to these families. This is very time intensive. And right now, the funding that they're offering to do this doesn't cover the expense to implement this. So I think it's wise to have this pilot site to see if it's really feasible. It's 11 core sessions and 7 supplemental sessions. So it's very time intensive. And then the state of Maine happily is re-implementing high fidelity wraparound. I'm very pleased about that because it was very successful in Maine previously. And so one of the things that we don't know is how they're going to ensure maintaining the criteria, the fidelity to the family peer specialist model. And right now, what they're telling us is they're using PEARLS training program for family peer specialist staff. So we still have to wait and see how that comes out. And then again, our continued challenges of implementing family-driven care. We have a lot of change at the state level, and so it makes it difficult over the past few years to have relationships with our state staff because they don't stay in those positions long. And then our system of care grant is ending. So we have to continue to mitigate that long HCT wait list until services are available. Workforce can be hired. just like every place across the country, workforce is the thing that is delaying service delivery to our kids, which is huge barrier. Next, and this is my contact information if you'd like to reach out to me to talk about anything that I've communicated today. Thank you all. And I would like to introduce Susan Stearns, who's the Executive Director of NAMI of New Hampshire. Susan.
Thank you, Cindy. It's really a pleasure to be with you all today. I think if we can go to the next slide, Sherry. So this has my contact information on it, or my email, but feel free to reach out to me. We can go to the next slide, just to keep things moving along here. So NAMI New Hampshire is a grassroots organization working to improve the lives of all people impacted by mental illness and suicide through support, education, and advocacy. We were originally founded in 1978 at the kitchen table of this lovely lady, Peggy Straw, who was a very dear friend of mine. In her own words, in an effort to help 6 hurting families. At that time, these were all families who, with adult loved ones, mostly living with thought disorders like schizophrenia. And from that small kitchen table, last year we served nearly 44,000 folks across our state and beyond. Interestingly, I come to this work, like everyone else here, as first and foremost, a mom. And my adult son, now in his early 30s, when I was going through what I called running the gauntlet of children's mental health services here in New Hampshire, NAMI New Hampshire did not have a lot. There was not really any support for me, not just NAMI New Hampshire, but in our state. We could go to the next slide, Sherry. Today we have here at NAMI New Hampshire 66 staff and over 200 statewide volunteers who come with all come with lived experience this work, including our 22 members of our board of directors. And I'm really pleased to be able to say that NAMI New Hampshire was a founding member of what is today New Hampshire's Children's System of Care. And up here on the screen are simply those core values of our children's system of care, being family and youth driven, community-based, culturally and linguistically competent, as well as trauma informed. I do want to call out the artwork on this page, which is from the recent Magnified Voices Expressive Arts event for middle and high schoolers here in New Hampshire. You can check that out on the Children's System of Care website and see all of the submissions. Truly incredibly moving event. And this particular piece was done by Olivia H. And you'll see where she talks about how life used to be brighter and now her experiences with her mental health challenges. I have to say, our youth inspire me every day. And I do think if we can just keep things together for the next decade or so, we'll be in good hands. Next slide, Sherry. So, as I mentioned, our system of care, we were founding members of it. It's a little over a decade old. Started with a Children's Behavioral Health Collaborative that then prepared the state to apply for some of those highly coveted SAMHSA System of Care Planning Implementation Grants. And we started implementing high fidelity wraparound on a very small scale at that point through that grant funding. In 2018, New Hampshire had a 1959 Medicaid State Plan Amendment approved, which established a Medicaid benefit for those system of care services, particularly high fidelity wraparound. And just in 2023, when the reapproval, it was expanded that benefit to include those services for the 0 to 5 population. We were really pleased at NAMI New Hampshire to have been part of the development of that 0 to 5 service. So when NAMI New Hampshire had employed those family care support specialists through those system of care grants, and when it came time for this to become a Medicaid benefit in our state, our board of directors, excuse me, had really robust conversations along with our volunteers across the state about what did that mean for us. We did not have any other billable service, so to speak, that we offered. All of our services were, support groups, trainings, family education, our advocacy work. And thinking back to 1978 and Peggy Straw's Kitchen Table, and our founders, who we fondly call our NAMI mommies, we thought it made no sense, and our founders would be indeed very disappointed with us that finally family peer support was being recognized as a valuable service, yet somehow NAMI New Hampshire would not be a part of that. So that was really what determined this path that sent NAMI New Hampshire on this journey, and collaborating with our partners in New Hampshire's high fidelity wraparound. Next slide, please, Sherry, which is called Fast Forward. FAST standing for Families and Systems Together. As you've heard from other folks, I think our high fidelity wraparound model is seeks to follow those best practices established nationwide, includes enhanced care coordination, the family peer support services, which is the only component that NAMI New Hampshire provides, youth peer support services, which is provided by Youth Move New Hampshire, and then really important, these customizable goods and services to allow us to indeed meet some of those needs, whether it be camp, childcare, assistance with utility bills, those things that really families need. It's fascinating that on this slide, has something that I have on another slide. So one of the things that we found, and so I'm going to be surprised, I think, by this entire presentation now that I see I may have sent the wrong one to Sherry. One of the things our evaluation has shown us is that families who engaged in wraparound for at least 6 months, their kiddos had fewer hospitalizations and overall improved well-being for the youth and the families. So we were really pleased to see these outcomes, and they continue today. Let's see what's on the next slide, Sherry. Okay, so great. We have today, NAMI New Hampshire has about 22 family peer support specialists on staff. We are the only entity providing the service in our state. We do indeed have certification and a comprehensive model with fully developed competencies. First and foremost is that lived experience in caring for a child with serious emotional disturbance. I think a lot of these services you have heard about from some of our other presenters, so I won't go into them each of them, but we are thrilled to report, I think this is going to surprise us on another slide, that about 45% of our family peer support specialists on our staff are graduates of the Fast Forward program. So when we think about workforce development, it's really wonderful to see how these families who determine, this program meant so much to me and my family. I want to help other families. Next slide, please, Sherry. Okay, so again, some of the impact and outcomes that we have seen in terms of our children's system of care is that in addition to what I mentioned, I had combined them all on one slide, but okay, this is special. Using the standard community supports for wraparound inventory, we do see that both the access to family and youth peer support is a significant strength of the model, and that families report the family and youth peer support is meaningful to them. And we consistently hear that from our partners in wraparound as well, how important that the family and youth peer support is. I think for all of us, there's really nothing that can beat peer support in terms of being there and feeling less isolated, and also developing your own advocacy skills. So we have seen tremendous growth in wraparound services here in New Hampshire in the last 5 years or so. Point out in February of 2020, before the world kind of changed dramatically for us all, we had about 175 families enrolled, and today there are about 600 families enrolled in Fast Forward. I think that this is both the size comes from what would have happened. The program was sizing up, but obviously that impact that we saw with COVID, and that just so exacerbated our children's mental health crisis. And I do not want to discount those social justice issues that were first and foremost, so prominent and have been the last several years, and their impact upon our youth. And I think I think that we need to continue to remember that our youth are really plugged into those social justice issues. And when they see injustice, it has a significant impact on their mental health. I mentioned the fact that we have 45% of our folks are family peer support, our folks who come through the Fast Forward program. We have had some challenges. One in particular is how the service is billed. It's currently billed as a 15-minute unit rate. The only piece component that in the youth peer support, so the peer support components are the only ones that are billed at that 15-minute unit rate in our state Medicaid plan amendment. The rest of the service is at a daily case rate. So this does mean that the state of New Hampshire has to provide general fund dollars to supplement the costs, because the 15-minute unit rate does not cover those costs, largely because of administrative burden related to having to bill in 15-minute unit rates, and also that travel is not covered, and we do provide the service in homes and communities across the state. Next slide, please. So some of the work that we have done across the lifespan as an outgrowth of this, of really NAMI New Hampshire's mission, and certainly some of it as an outgrowth of our family peer support for families of kiddos. The state had an 1115 Medicaid waiver, which we were able to do, which is a demonstration project, and we were able to be part of that integrated care work. And that's really where we piloted doing the work with those families of children 0 to 5, which led to that recent change in our state plan amendment. We currently have a contract with the Concord School District here in the capital of the state, where they've gotten us a SAMHSA grant to provide family support in the school district. And then we've also, and this through private foundation funding, been able to co-locate family peer support at one of our community mental health centers on the towards the seacoast part of the state. And that has yielded some really interesting results as well. Indeed, 67% of those families, and these are sometimes families of youth and sometimes families of adults, typically young adults. They found 67% showed improvements in the rating of whether their loved one's condition impacted their own self-care. I think all of us know how hard it is when you have a loved one living with a serious mental health challenge. 60% indicated that they increased the number of supports and connections in their own lives. These family members did. And these are pre-post evaluations, pre-engagement, post-engagement with family peer support. And 70% reported an increase in their understanding of their loved one's mental health condition. We also have been providing, through a subcontract with our transitional housing provider here in the state, peer support for participants there. These are adults, but we also provide that support for their families. And it's also one of those interesting things is how often our adult peer support folks come from families, and so have that family experience as well. So I think we have to always be mindful, and I say this too in terms of our clinical partners. There's a false dichotomy, right? That somehow one is either a clinician or has lived experience, for example. We also do peer support for older adults and their families at the state's Glencliff home in the northern part of the state. And we are very hopeful. We were invited to submit an application to a private foundation to provide family peer support for the families of children boarding in emergency departments across our state. As of yesterday afternoon, we have 11. And those are, frankly, some of the most traumatic stories I hear about is what children experience and their families experience while their children are boarding, sometimes for weeks, in emergency departments. So we are really hopeful, and I would take positive thoughts from anyone that funding comes through. So I think that's my last slide, because, is it? Yes, it is. Okay, thank you. So it's my pleasure now to introduce our next speaker, Sandy Yandau, the Executive Director of the Vermont Federation of Families for Children's Mental Health.
Thanks. I'm going to try to be really quick because I notice our, and I also want to share, Vermont is a very small state, but we have been at this family peer support since Vermont is very unique. In 1988, what we call Act 264 was a piece of legislation passed in Vermont that families who were raising children with SED were so excited about. It came about after a 5-year system of care grant through CASP, which was kind of the precursor to SAMHSA, and to develop a system of care in Vermont. And what Act 264 created was an entitlement to a coordinated services meeting that included interagency partners from child welfare, education, and mental health. And it was critical at the time in Vermont because families were just falling through the cracks. And so this legislation required that human services and public education work together, that it involve parents, that it coordinates services for better outcomes for families instead of receiving partial and fragmented services and supports through the separate doors. What it also did is in 1988 created a peer support position that would be funded through an Agency of Human Services stipend, which at the time was $25 for any work 4 hours or less, $50 if they ate and under, not to exceed $50 at any time. In 1990, the Federation, Vermont Federation of Families for Children's Mental Health, was founded. Following, we were instrumental in getting the Act 264 legislation. We too had a founding member, like New Hampshire. I like NAMI Mommy, who Judy Sturdivant, who sat with families at her kitchen table, very much from the grassroots. We were founded very much the same way. What that legislation called for was we have 12 regions in the state of Vermont under the Agency of Human Services, which wasn't the Agency of Human Services way back then, but 12 regions that we were going to have 12 peers, families with lived experience, who would be part of regional teams to create these coordinated service plans for families. There was no entitlement to services, just an entitlement to the coordinated services. But back then, we envisioned that from that, that was going to be our workforce development. That was in 1988. 35 plus years later, that has recently eroded to the point that it has completely fallen apart, which we have been predicting and watching for the last 10 years because of sustainable funding. That the Federation always envisioned that to be the feeder workforce, that parents would come in as an entry-level peer, be part of regional teams. The Federation would help encourage and empower them. We have had a statewide family network grant through SAMHSA for many years. We have used that funding to support those individuals because it wasn't a guaranteed, it wasn't guaranteed employment. I liken it to being an on-call substitute teacher that you never know from day to day whether or not you're going to have a meeting, but you're required to really reserve 40 hours of your time per week, hoping that you might have a meeting. And for that, you might get $25. That is not sustainable in a workforce. So the Federation, partnering with the Agency of Human Services, informally partnering because we weren't contracted, we hired them. What under Act 264, they're called parent representatives, local interagency team parent representatives. So of the 12, we would hire them to do work for us as peer supports. Over the years, we just could not recruit and fund because we didn't have sustainable funding. We're not Medicaid billable, we're not whatever. Fast forward to 2024, that whole lit parent rep under Act 264 has deteriorated because of the need for sustainable funding. The recognition from our state that you couldn't recruit anyone. So through the Federation, we have had 4 incredible, in 2022, we had 6, there were 6, they were down to 4, who have for 15 plus years kept this going, served as lit parent reps, not only to their regions, their 4 regions, but have taken on regions that didn't have a dedicated lit parent rep. So thanks to COVID, and going to Zoom meetings versus traveling the state. Vermont is small, but logistically, we can't get from one end to the other without 3 hours of travel. So COVID did us a great favor in stretching what money the state did put in to fund their stipends. So in Vermont, peer support, there has been no dedicated funding. We have 1 grant from the Department of Mental Health that does fund 1 position, and that is for an individual who sits on a piece of Act 264 that's called the Case Review Committee. And at the Case Review Committee, that's where applications for residential care for kids happen, for those at the highest pinnacle of need. And so that funds very small. So Vermont, I would say we are strategically on July 1, a application recently went out to take over the whole lit parent rep program and revise it and whatever. There were 2 applicants. We were one of them with 30 years experience watching this and supporting it. It was not awarded to us. We are in an era of that we have fostered everything about us, nothing about us without us, and feeling to a point that we are at a stage of everything about us without us. So it's really time, to stop, dig in our heels. I'm really excited. The four individuals, the independent, self-employed individuals who have carried the lit parent rep program as it was envisioned, were not told that they were not going to be hired by the new contractor. They have not been told anywhere in the system. It is heartbreaking to see how individuals who have given so much to so many for so long. The exciting thing is the regions that they serve are outraged. So Vermont is in a very interesting place where it's not only the Federation who's going to be advocating for change. It is the community health centers where they have served so many. It's going to be the interagency tables at which they've sat that are going, what the heck is going on? So I'm looking forward to what's going to happen in Vermont. I think it's a great opportunity. You can't have legislation that mandates workforce without putting in funding and figuring out how that's going to happen. And the thing that happened in 1988 was this was focused on one disability population, and that was children with mental health who qualified for SED. And in 2005, it was expanded to include all disability populations under the IDEA. You don't have to be a mathematician to know that when you expand one population, by 16, that you're going to need a whole lot more resources. So I hope we do another one of these next year, and we see where we are next year, and that Vermont has great and glorious things to report. But the thing that happens as a result of this, those 4 lit parent reps who will not be going, who also work part-time for us, who never had any time for us, now have 100% of their time that they can be dedicated to Vermont Federation initiatives and things that we have wanted to do under our statewide family network grant for a very long time. And Cindy can probably relate because we've talked about the workforce that I inherited, and we have talked for many years about how frustrating it was to have wonderful and talented people who I wanted to become certified through the National Federation and who said, why? Will it make me any more employable? And if I'm employable, if there are no jobs, then therefore, what's the thing? Now I have an answer for them. So, bad news is sometimes great news. So that's it from Vermont. So.
Thank you so much, Sandy. We did pack in a lot of speakers today, of course, presenters, and as you can tell, they have a wealth of information and knowledge to share. So we're glad that you guys took the time to do that. It's very important. If there's a couple of questions, since we're such a small group, we can go ahead and do that. But I did just want to let you know that there is a survey or evaluation. I put the link in the chat a couple times. It will pop up when you close out of the webinar as well. And I also want to thank our presenters today, Gail, Jenny, Pam, Cindy, Susan, Sandy, as well as the New England Mental Health TTC, Maria Restrepo-Toro, Director of the New England MHTTC at Yale Perch, and Christine Irizarry, who was here helping us with tech for most of the today's presentation. Thank you to her and to everyone who attended. If you do have a question, feel free to unmute and ask your question or raise a virtual hand. If not, please feel free to contact the folks through their contact information. Don't see any hands popping up yet or anyone unmuting. I'll give it just another few seconds. And it was a lot of information to digest. So sometimes you go back and use the contact information, that would be great. And we will be posting this and sending out the recording to everyone who registered. So thank you again to our presenters. Thank you for being here, attendees. And not seeing any raised hands, but thanks very much. And we look forward to working with you all and seeing you all again soon. Have a great day.
Bye.